Hello everyone, welcome to sqadia.com, and in our third section of implantation and early pregnancy, we will talk about ectopic pregnancy. We will talk about the causes and definition of ectopic pregnancy, what are the symptoms and complications of ectopic pregnancy, and how it is investigated and treated. First, what is ectopic pregnancy? Ectopic pregnancy is the pregnancy that occurs outside the uterus. Most of the ectopic pregnancies occur about 93% in the ampulla of the fallopian tube. This is the ampulla, broad portion of the fallopian tube. Most of the ectopic pregnancies take place in the ampulla. 4% take place in the isthmus portion of the fallopian tube. This portion that is little lower, closer to the uterine end. So this is the isthmic portion of the fallopian tube. Then cornua, this is the cornua where 2.5% ectopic pregnancy takes place. Abdominal, very few, about 0.03%. And cervical, in the cervix, you have 0.1%, and ovary is 0.5%. So very small amount of ectopic pregnancies takes place other than the fallopian tube. If combine ampulla and isthmic region, so about 93 and 4, about 97% of ectopic pregnancies takes place in the fallopian tube of the female reproductive system. So ectopic pregnancy is the pregnancy outside the uterus. Tubal pregnancy is the most common site for the ectopic pregnancy. Sometimes it takes place in the ovary and abdomen. Most common cause of ectopic pregnancy is if there is surgery of the tubes. After the surgery, usually adhesions form. Even surgeries outside the female reproductive system, surgeries in the abdomen, later on leads to adhesion that cause different organs of the abdomen. They stick together and form scarring and adhesions. That's very important cause of ectopic pregnancy that leads to blockage of the tubes and infections of the tube, like diseases like pelvic inflammatory diseases also cause the ectopic pregnancy and blockage of the tube. So all these are common causes of the ectopic pregnancy. So pregnancy outside the uterus, mostly it's in the fallopian tube, about 97%. And the causes of ectopic pregnancy, it can be due to obstruction, it can be due to adhesions, and it can be due to infections and birth defects. Some symptoms and complications of ectopic pregnancy are since the fallopian tube is not big enough to give enough space for the growing embryo, so the most common complication of the ectopic pregnancy is as the baby grow, there is not enough space, so there is the rupture of the tube. And with the rupture of the tube, this is tubal rupture is emergency condition in which emergency laparotomy is done. Laparotomy means in emergency, doctor opens the abdomen and then repair that rupture, or in most of the cases, they have to remove the fallopian tube and the ovary. So that's very common complication of the fallopian tube. In the beginning, the signs and symptoms of ectopic pregnancy is the same as the normal pregnancy. So in the beginning, it's very hard to tell if the pregnancy is ectopic or if the pregnancy is normal pregnancy in the uterus. Pregnancy test is positive. Females have the same amenorrhea first, then a positive pregnancy test, then they have morning sickness, and this was diagnosed when they go for the routine checkup of the for the normal prenatal visit to see the doctor, and when the doctor does the transvaginal ultrasonography is done and they see there is no uterine pregnancy, there is no pregnancy in the uterus, then the first thing that comes to the mind of the doctor is that this is the ectopic pregnancy. Then further testing is done to find out where is pregnancy. So empty uterus on the prenatal visit is the first indication of the ectopic pregnancy. Sometimes in the ectopic pregnancy, as the pregnancy grow or develop, there is spotting and there is bleeding and fainting, and very bad pain in the abdomen occurs. So this is, and sometimes there is the tubal rupture, which is the emergency condition. How it is investigated, as I mentioned, transvaginal ultrasonography is the first indication. Empty uterus, no pregnancy in the uterus, that gives the indication that this might be an ectopic pregnancy. Then there is intrauterine pregnancy should be detected when HCG levels are about 1500 to 2000. If the HCG levels are 2000 and there is no intrauterine pregnancy, it means there might be an ectopic pregnancy. In normal uterine pregnancy, in normal pregnancy, HCG levels doubles every second day. So that's also an indication of the normal pregnancy intrauterine. Medical management of the ectopic pregnancy by methotrexate. Nowadays, they use methotrexate to treat it medically. And methotrexate, what it does, it slows down the growth of the cell at the ectopic site. So, in the basically, why this medicine is used, so slowly it can help regressing the ectopic pregnancy, or slowly it can be reabsorbed, or it shrinks to such a small extent that it can be reabsorbed by the body. Surgical management is the other type of treatment for ectopic pregnancy, in which the tubes are removed, or in some cases ovary on that side is removed too. So that's called the salpingectomy, if only fallopian tube is removed on one side. If the fallopian tube and ovary both are removed, this is called salpingo-oophorectomy, and one side tube and ovary is removed. That reduces the chance of conception to half, 50%. So this is the management of the ectopic pregnancy. So this was the section in which third of our lecture topic, implantation and early pregnancy, in which we talked about the ectopic pregnancy, which is the pregnancy outside the uterus. Thank you for watching sqadia.com.